Hi, everyone. My name is Catherine, and in case you don't know, I'm the founder of Femtech Insider. And here on this channel, I get to speak to a lot of other Femtech founders every once in a while. And I'm extremely honored today that Sophia Yen from Pandia Health is joining me. And we're going to talk a little bit about what Pandia Health does and also how Pandia Health does the things they do. And Sophia, thank you so much for joining me. I am incredibly excited to have you today.
Thank you so much for having me. I love what you do and what you cover. It's such an important topic.
Awesome. So maybe to get started, Sophia, let's get to know you a little bit, and maybe you can tell us what Pandia Health does.
Yeah, so my mom said, always claim your titles. So everybody out there, claim all your titles. And so I'm Dr. Sophia Yen. I'm
I
also
apologize. I'm
No,
sorry.
no, 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 no need to apologize.
Yeah.
Just it's my duty to know my titles,
Yeah.
not your duty to know my titles.
Yeah.
And I'm also a clinical associate professor at Stanford Medical School in the Department of Pediatrics, the Division of Adolescent Medicine. But today I'm here as the CEO and co-founder of Pandia Health. And a little bit about my academic background, if you're interested in that. I went to MIT for undergrad, UC San Francisco for medical school, Children's Oakland to specialize in pediatrics, and then another 3 years at UCSF to, excuse me, to specialize in adolescent medicine, and then another year at UC Berkeley to get my master's of public health, and then eventually wandered down to Stanford to begin my academic career there. And about 6 years ago, I was giving a talk to a bunch of physicians. Why don't women take birth control? Why are they so irresponsible? And one of the top reasons it came up was because they didn't have the medication in their hand. And in the United States, and I don't know about other countries, but unfortunately, our insurance system requires that women go to the pharmacy, and they are limited to only going 7 days before the medication runs out. And for anyone who's ever been on the birth control pill, but for those who haven't, there's 4 weeks of 7 days of pills. And as you get to this last week, if you don't get to the pharmacy by this last day, there will be a very negative potential consequence, an unplanned pregnancy or bleeding when you don't want to bleed. And so a very responsible woman most women plan it such that it runs out on Sunday, would go the Sunday or Saturday before because she doesn't have work, she has time, she goes to the pharmacy and the pharmacist says, sorry, you have to come back on Monday. And she's like, no, I have work, I have meetings, I don't have time, I'm here now, please give me my medicine. No, it's not the pharmacy, it's the pharmacy speaking on behalf of the insurance company. Sorry, you have to come back tomorrow. And so everything else at the time, this is about 6 years ago, was coming in the mail. And it's like, well, why don't we have this come in the mail? And there were mail order pharmacies, but their target audience were 70-year-old white-haired people holding hands with 5 drugs 3 times a day. And I was like, this is a medication where women are using it from age 20 to 45 to 50. And let's make it delightful. Let's make it mobile. Let's include some goodies in here, some educational materials, and let's just let women set it and forget it. Let Pandia worry so you don't have to. And we call that, I'm all about hashtag Pandia peace of mind. We purposely chose the name Pandia, the Greek goddess of healing, light, full moon. And then I think it was fate. I made up the definition. Pan is every, dia is day. So we have you covered every day. So that's kind of in a quick nutshell how Pandia Health started and how it came to be.
That's great. Sophia, you also speak a lot about the need for doctor-founded, doctor-led companies in the femtech and I guess in the whole digital health space. Could you talk a little bit more about this and sort of why you think it's important?
Yes. So I'm very proud that Pandia Health is the only doctor-led birth control delivery company in the United States. We are also the only women-founded, women-led company in the birth control delivery space. And the doctor component is really important because this is about people's health. This is not just another startup, because in the startup world, you might have heard, break the rules and apologize later, work fast and deal with the problems later. And you can't do that, I feel, and you shouldn't do that when you're talking about people's health. You can't be like, oops, didn't know that, because this could result in someone's health being harmed in a very bad way. And it could also result in someone being pregnant. And so I am the only CEO of a birth control delivery company that I know of that has taken the Hippocratic Oath: do no harm. And as long as I'm CEO, and as long as this company holds the values that we originally started it with, we will always tell patients and customers what is best for their health, even if it doesn't benefit our bottom line, because I will make money for my investors, but I don't have to do it pushing a medication that is not in your best interest, or withholding information and not practicing standard of care. So standard of care for everybody as you approach telemedicine is providing informed consent. So anything a physician would do in their office to the best of their ability and most logically fits online, they should also do online. So online, we should be able to provide you the birth control pill, patch, ring. And so for the telemedicine part of your visit, the physician can, in the United States, can write any of those drugs, can send it to any pharmacy of your choice. For the pharmacy part, because the unique thing about Pandia Health and a lot of these companies is we're bringing together both the physician and the pharmacy under one roof. So the end-to-end solution, set it, forget it. So there's no excuse to run out of birth control. For the pharmacy part, that's where the money comes in. If we are losing money on the patch or the ring, we don't have to mail that to you. But on the telemedicine part, I should offer you all those options, and I should send it to whatever pharmacy you want. But this part, I can just fill the parts that I make money, and the parts that I don't, I'll send to another pharmacy that will take care of your needs. But we need to make sure that as we move forward with telemedicine, and it is absolutely the future, that they provide standard of care, that they provide informed consent, and that they separate the telemedicine and the pharmacy functions, the provide everything that you deserve versus provide only the things that you make money. And that, I've seen some practices very odd where they're like, do you want this vitamin? And certainly as a physician, I'm like, yes, you need to take a multivitamin, you need a calcium with vitamin D, but I don't stop in the middle of my visit with you. Do you want this brand vitamin? And can I sell it to you? Never have I seen that in a physician's office. And so you need to end the telemedicine visit. And certainly you can have a shopping cart that you have now entered the pharmacy. And now, would you like condoms? Would you like lubricant? Would you like a pregnancy test? Would you like a calcium vitamin? Would you like a vitamin B vitamin? And not just one, but here are 5 or 6 to choose from, because it seems very fishy if you're pushing a particular one.
Yeah, that makes a lot of sense. And I mean, I'm personally also a huge advocate for, sort of early on bringing chief medical officers and, proper medical advisors and collaborating with sort of, leading research groups in, whatever field you're in order to, make sure that the quality of care is really where it should be in these Femtech companies and like digital health companies overall.
Yeah. And I think the critical thing that you did bring up to my mind is chief medical officer. So I want people to know when they go on a telemedicine platform, you don't know exactly what is the role of the chief medical officer. Maybe they oversaw the protocol, but did they know that when they implemented the protocol that they omitted one of the 3 methods that they should be providing? How often is this chief medical officer checking in? Is this chief medical officer teaching all the physicians that sign up a standard protocol, a standard of care, or is every doctor just doing what they want? And are they following evidence-based medicine? And where and what is the background of this chief medical officer? So I've seen companies for birth control that are founded by ophthalmologists. And how much does that ophthalmologist really know? And they brought in a great, OB-GYN physician, chief medical officer, but did she know the way that her protocol was being implemented? And so I, as the CEO of the company, am in everywhere in my company, and we've trained all the physicians. This is best practices. And we've made sure that our protocol is implemented according to how I would want to be treated, but also the standard of care.
So we talked a little bit about this role of a chief medical officer in a company. So we know that, there's a lot of companies in our space, in the femtech space, that, are founded by women that are genuinely trying to solve their own problems. And sometimes I feel they struggle a little bit in the beginning, when you're a small startup that nobody really knows, to kind of, get attention from these research centers to, kind of, how do you even start to recruit for a chief medical officer, or how do you find your first your medical advisors? Do you have any advice for these women that, are really generally maybe trying to, make sure they're doing things the right way, but are struggling a little bit to get started?
I think that it is critical to, one, not just pick any physician, right? You want a physician who knows their stuff. You want a physician who is academic, who knows how to read the papers, who has the connections with the different groups. And that is also a differentiator of our company. I am probably the only academic physician CEO and chief medical officer. I've published papers, I'm known in the field, I attend the society meeting. So I would say make sure your chief medical officer has some of those qualities and certainly has experience and is not a newbie, new graduate. A newbie, new graduate's great as a worker bee, but not as a, connector and trusted kind of person. But certainly, there's exceptions to every rule. The easiest way, as we all know in startups, is you reach through your channels and your connections. But also, we also know from, startup world, you can just blind email people. And the beauty of academia is you can often find their email on their academic website and you can send them the note. The problem is, are they willing to leave or devote their energy from their academic career to be part of your startup? Are they afraid to lend their authority to your company unless they feel they can trust you? And that is one argument that I put in front of VC for funding my company, is because I've been 20 plus years in the reproductive health field. People know me. I have domain expertise. I live, breathe, eat, and prescribe birth control. So it is also personal to me. And I have 2 daughters. And so I can reach out to other physicians. But if a fresh grad shows up and says, hey, you want to play with me? Would I dare touch you and risk my Stanford career? Would I dare touch you and risk my academic career? What if you are crazy and all you care about is money and you destroy people's lives? Then my career is destroyed as well. But long story short, reach through your connections in terms of your physician or your good friend's physician, but you can also blindly reach out. And I actually do have a couple of physician friends that are tired of the rat race in medicine and absolutely interested and willing to become a chief medical officer. And I find a lot of physicians, there's groups that I as a physician can get into that others that are non-physicians cannot. So even if you have a physician friend that is not in the field that you want, they probably went to medical school with somebody, or they know a professor that they could approach, or somebody who's about to retire. Those are kind of good people that are about to retire, so that they want some extra income. They don't want to do the clinical stuff, and they'd be willing to bring their connections, their expertise to your company, assuming your company has a great mission and a great purpose.
That's super insightful. Thank you so much for sharing all of this. Maybe going back on that point that you mentioned in terms of the trustworthiness of actually, the startups that you work with, like, what are some of these kind of trustworthiness factors that, you or maybe some of your colleagues might look into in those new projects that they, might consider lending their names to? What kind of, sort of instills trust in you?
I think what instills trust in an academic medical person is somebody with similar credentials. As you mentioned, one of your co-founders was in pharma. If somebody has a PhD or a science degree and not an MBA basis, and if they have an MBA basis, might be a little skeptical of them. I think also a little maturity, right? Not just straight out of, college and looking to make a buck, or what, and are they money driven or are they purpose driven? And certainly the most inspiring ones are patients who have suffered from a horrible disease and want to make it better. less or more suspect is a male who has no uterus, who's never used birth control, and somehow is really into birth control and birth control access. Though there certainly are allies like that. And certainly there are a ton of OB-GYNs that are passionate about birth control. But somebody who has a sister or somebody who just, is a good person is not necessarily as driven. And then the hard part, I think, this is a question for physicians, is they are choosing people to partner with. You don't know where the funding is going to come from and how that's going to alter the relationship. You may have a relationship with the CEO, but then they get funded by somebody that is just pushing financial pressures on this company to do stuff. And so how much is this CEO vested in making sure that they don't push your ethics, push your morals, push the line? And that's sometimes a conflict between startup. You want to do something new and innovative, but does that put a person's health at risk? Is that on that CEO's mind, right?
Super helpful. Yeah. Sophia, maybe to wrap up, I'd love to talk about one more thing that you're very, very passionate about, and that is periods optional.
Yes, this is, I think, TEDx Berkeley gave me the opportunity to share this with the world, and sort of my moonshot. My moonshot is a world where those with uteruses only bleed during the months you're trying to get pregnant. Because when I was trying to get pregnant, I realized the only reason that those with uteri bleed is you were building that lining, waiting for an embryo didn't happen, and you bled. And so the only reason to risk cancer, every time you build that lining, it could have a mutation and you could get endometrial cancer. Every time you pop out an egg, you could get ovarian cancer. And then every time you bleed, you risk anemia because you're losing blood. And so if you're not trying to make an embryo, why are you doing all the hormonal processes of hormones going up and down, up and down, up and down for 20 to 40 years of your life, if you're only trying to catch an embryo twice on average in most countries and maybe more in other countries? The other key thing with periods optional is people are like, aren't you supposed to have a period every single month? It's unnatural not to bleed every month. And the critical thing here is the research of Dr. Beverly Strassman. She studied the Dogon tribe in Mali now, which is not like 50 years ago, but now in a society that is untouched by the hypercaloric options that we have in the United States, tons of calories. As soon as you hit 100 pounds or 22% body fat, you get your first period. So the Dogon tribe gets their first period at 16. We in the United States and other industrialized countries with lots of extra calories around us get our first period at 12 and a half. They have 7 or 8 periods a year. We have 13 periods a year. They have 8 children. We have 2 children. They breastfeed for 12 to 18 months. We breastfeed for 0, 3, or 6 months. They have 100 periods in their lives. We have 350 to 400 periods in their lives. And we die at approximately the same age, 70, 75-ish. So it's not like they die at 30 and that's why they have fewer periods. And so we are having 3.5 to 4 times the quote natural number of periods. And as my OB-GYN professor at UCSF used to say, the natural state of the female animal is pregnant or breastfeeding. How many periods do you have when you're pregnant? 0. How many periods do you have when you're exclusively breastfeeding? 0. And so this incessant menstruation is a new modern construct that we haven't been able to evolve to adapt to during our time. And the natural state is far fewer periods. And for women to realize that to do this, you have to right now do it hormonally, and you probably have to do it hormonally as going forward. And right now what we have is you can use the IUD, the implant, the shot, you can use the birth control pill patch ring, and they've shown that the benefits of using the pill patch ring outweigh the risks. The main risk is increased breast cancer. And so it may increase your risk. It does increase your risk of breast cancer, like 16 out of 100,000 women that use it. But the decrease in ovarian, endometrial, and colorectal cancer outweighs the increased risk of breast cancer. And every woman and every person with a uterus has to make that decision with her physician or it on her own. You know, it's up to you. But for me, it was mainly, it's about equality. I'm in the middle of a biochemistry test in MIT, pre-med, very intense. And all of a sudden, blah, blood. And oh my goodness, do I run to the bathroom or do I finish the exam? And being a pre-med, I finished the exam. But was I a little distracted? Yes. I looked to my left, I looked to my right at MIT. And here's a guy, boop-a-doop-a-doo. Here's another guy, boop-a-doop-a-doo. And meanwhile, you know, would that I were they. I have 2 daughters and I want them to be on par with those without a uterus. And I ask any parent out there, is your young person going to do better on her final exams, SAT, MCAT, GRE, or whatever the equivalent is in Europe, on her period or off her period? And then the #1 cause of missed school and work in most industrialized countries and even unindustrialized countries, and a woman under the age of 25 miss school and work, is menstruation related to her periods, heavy periods, painful periods. And I've had women go, well, it just runs in my family. It's natural. Just because it runs in your family doesn't mean it has to be. So please, anybody with a uterus who's missing school and work, please, please, please see a healthcare provider and get some medication to take care of it. And the first line medication doesn't even need to see a physician. You take 400 milligrams of ibuprofen or its equivalent with food. If you take it on an empty stomach, you'll come back complaining of ulcers or pain, so please. And then if you don't have any kidney problems, up to 3 times a day for up to 5 days, that will decrease the amount of blood by 30%. And if that isn't enough for you to function or go to work, then you need to see a provider and talk about other hormonal options. The other thing is landfill. Everybody is very concerned, and as you should be. We use in the 350 to 400 menstruations in a lifetime, 10,000 to 13,000 menstrual products. So if you haven't evolved to the Diva cup or, you know, variants of that, that is one option. The other option are the bleeding panty options. And those are greener ways to go. But if we have fewer periods, then we will have lower need and we will contribute less to landfill. And then the interesting thing is if you have asthma, depression, acne, any headaches related to your periods, if we get rid of your periods or have fewer periods, all of those conditions are better, because when we do it by maintaining your hormone. And so instead of up and down and up and down and up and down, your depression, your asthma, your diabetes, your seizure medications are dealing with this up and down and up and down and losing of blood and using of energy. Instead, it's just something smooth. Your body likes smooth. Your body likes regular schedule. Your body does not like up and down, and our bodies weren't built for that.
So periods optional.
Periods optional. And if you want a recap of this, go to pandiahealth.com/periods optional. And at the bottom is my TEDx talk.
We'll make sure we link it also in the description to this video. Sophia, thank you so much. This was incredibly inspirational. Thank you for everything that you do for women's health and, you know, yeah, for us as a Femtech community.
Thank you for what you're doing and highlighting Femtech and the need for, I feel, you know, evidence-based, cutting edge and patient-centric healthcare.
Thank you, Sophia.